Now we will continue with you the second type of intermediate uveitis. It is the intermediate uveitis. Intermediate uveitis, it is inflammation of the pars plana of the ciliary body with inflammation of the extreme periphery of the retina and the choroid. And in between these areas there is the anterior vitreous, so the anterior vitreous will be affected also in intermediate uveitis. So intermediate uveitis, it is inflammation of the pars plana. Pars plana, it is the posterior part of the ciliary body. The anterior part, which is called the pars plicata, it is inflammation. If the pars plicata is inflamed, it is type of anterior uveitis. But in intermediate uveitis, the inflammation present in the pars plana of the ciliary body and the extreme periphery of the retina and the choroid, and in between the anterior vitreous. This photo showing the pars plicata here of the ciliary body, and here this is the iris. So the iris and the pars plicata, if these sites inflamed, it is anterior uveitis. But the pars plana, if it is affected and it's adjacent retina and choroid, so this is the intermediate uveitis. The cause of intermediate uveitis, it is usually idiopathic, but there are some causes may produce intermediate uveitis, as tuberculous infection or multiple sclerosis. It is insidious in onset. It will produce some sort of chronic uveitis. It is usually affect the children and young adults, especially females. It is about 8% of all cases of uveitis. It is usually bilateral in 80% of cases and usually asymptomatic. So, if the intermediate uveitis is asymptomatic, how we can diagnose it? Because the patient will not come to you in your clinic because he has no symptoms, so it is accidentally discovered. Once the patient is going to the ophthalmologist to do anything like glasses prescription, and the doctor examined him well and see the periphery of the fundus and see the vitreous, the doctor may find the intermediate uveitis in the form of the following signs. Here you can see in the upper left photo here, these cells present in the anterior vitreous. So these cells indicating the presence of inflammation, and on dilatation of the pupil we will find some sort of vitreous haze, which is called turbid vitreous, or we may notice white dots present near the pars plana of the ciliary body in the extreme periphery of the fundus, and these snowballs may be collected to produce snow banking in the other photo on the left side. So after these signs, starting by the vitreous cells, vitreous haze, snowballs, snow bank, it is intermediate uveitis. It is an active form of intermediate uveitis. But if the intermediate uveitis becomes inactive, you can see the picture at the right side here, the upper picture here. You can see the RBE changes at the periphery of the fundus, the hypopigmented and the hyperpigmented RBE, indicating scarring present here in the periphery of the fundus, indicating inactive form of intermediate uveitis. You can see from this photo the whitish spots present in the vitreous in the lower extreme periphery of the fundus, which is called snowballs. This is the snowballs within the vitreous cavity. Also another picture showing multiple white dots at the extreme periphery of the fundus in case of intermediate uveitis. So the causes of intermediate uveitis, it is mainly idiopathic, but it may be produced due to tuberculous infection or multiple sclerosis disease. This is a comparison between anterior uveitis and posterior uveitis. So we will start in the posterior uveitis to know this comparison. So I give to you the anterior uveitis, its symptoms and the signs, the intermediate uveitis, and now I will discuss with you the posterior uveitis. In patient with posterior uveitis, which is inflammation of the choroid and retina and adjacent structures like the optic disc head and the retinal vessels, producing either choroiditis, retinitis, papillitis, or vasculitis. What are the symptoms of the posterior uveitis? The main symptom of it is starting by floaters. The patient will complain from floaters in the vitreous and maybe defective vision. Why maybe? Because the lesion may affect the periphery of the fundus, producing only floaters, or it may affect the center of the fundus, especially the macula and the optic disc, producing defective vision. Also, the patient may complain from seeing metamorphopsia. Metamorphopsia, it is seeing the objects distorted. This object may be larger than its size, it's called macropsia, or smaller than its size, it's called micropsia. Also, the patient can see flashes of light, which is called photopsia, or he can't see some parts of the field, which is called scotomas. According to the signs, starting by this sign, it is turbid vitreous, which is called vitreous haze or vitritis. Another sign, the presence of multiple inflammatory cells at the anterior vitreous. So vitritis and the presence of vitreous haze and the presence of vitreous cells indicating posterior uveitis. But the posterior uveitis, as we said, may be only choroiditis. In cases of choroiditis, you can see this picture with intact retinal vessels and these yellowish patches present below the retinal vessels. This yellowish patches, it is either solitary patches or multiple patches. These patches of choroiditis, it is well demarcated yellowish patches present below the retina. This is the case of active choroiditis. But in this photo there is some pigmentation present inside the yellowish patches. It is indicating starting of resolution of this active choroiditis. But in this photo all the lesions becomes heavily pigmented, so this is a case of inactive choroiditis, but after affecting the central vision of the patient. In this photo you can't see the retinal vessels, but you can see whitish patches on the retina, multiple patches, and these patches is ill-defined in margins, so this is a case of retinitis. It is a multiple whitish ill-defined patches on the retina in which the retinal vessels we cannot see it, so this is a case of retinitis. This vasculitis produce which is called candle waxing of the vessels, so the walls of the vessels is very weak, leading to hemorrhage in between these vessels, so this is a case of retinal vasculitis. Exudative retinal detachment is one of the complications of posterior uveitis. You can see here at the lower retina is detached due to presence of exudative cause, which is called the posterior uveitis, producing severe exudation below the neurosensory retina, producing exudative retinal detachment. Also, papillitis is one of the types of posterior uveitis. Here you can see the ill-defined edges of the swollen disc with pre-retinal hemorrhage around the disc, which is the signs of papillitis. So, how we can diagnose a case of uveitis? It is started by the history taken well from the patient, and then general examination of the patient. All the body should be examined because, as we said, uveitis may be associated with systemic diseases like arthritis, or may have another signs or symptoms, either neurological signs or skin signs in cases, for example, in Vogt-Koinagi-Harada disease. After the general examination, we will examine the eye very well, starting from the lid up to the optic nerve. And the last thing, it is the investigations. What are the investigations? We can do it for a uveitis case. All the investigations of the body, because it is a systemic disease. So you should examine or investigate all the body, starting from the CBC, complete blood picture. You can do investigations for syphilis, investigations for TB, investigations for bacterial or fungal infection. Also, the aqueous tab and vitreous tab may be helpful in some cases. Fluorescein angiography, OCT, ultrasound on the eye, or another systemic investigations like chest X-ray and MRI and CT. All the investigations of the body, we can use it to diagnose the case of uveitis if we cannot find the diagnosis by the clinical data alone. And